syringe pump are used to deliver powerful medications in very small amounts to keep patients in an artificially induced coma. Central venous access, or the central line, is inserted into a large vein. Its purpose is to administer drugs and fluids, measure central venous pressure, CVP, and provide access for hemofiltration and dialysis. CVP is monitored using a fluid-filled pressure transducer. All ICU patients will have continuous cardiac monitoring to assess heart rate and rhythm. ECG is recorded using a 3-lead system instead of the usual 12-lead ECG to make it more comfortable and easier to carry out the basic care of the patient, such as cleaning and moving. Any changes An endotracheal or ET tube is a flexible tube inserted through the mouth or nose into the windpipe. This tube, connected to the ventilator, aids in breathing and delivers oxygen. A nasogastric tube dribbles food or medication via the nose into the stomach. An arterial line allows beat-to-beat monitoring of the arterial blood pressure and sampling of arterial blood. They are usually inserted into the radial artery due to lower complication rates and ease of access. The line A critical care bed is like a standard hospital bed with a few key differences. At the foot of the bed there is an intermittent pneumatic compression device which inflates and deflates a pressure mattress in different areas at different times in a wave-like effect. This is important in preventing pressure sores, especially for patients who may be anaesthetized for several weeks. Special support stockings using massage-like pressure also prevent blood from pooling in the veins of the legs.